Well, welcome back to Mind Your Health. Today we're joined by Dr. Audrey Klenke, plastic surgeon, and Dr. Debbie Lyons. And some good discussion today
Yeah,
on what's
exactly.
new in plastic surgery and what we can look forward to.
We've actually had fun kind of behind the scenes chatting about all the new things that are coming out in the field of plastic surgery. And I think we're going to ask you a more broad spectrum question to get going. And that is, what's the definition of plastic surgery? What are some of the
Sure.
things that you do?
So plastic surgery has evolved, and it's interesting to me, sort of the irony of the name. So plastic surgery refers to just the plasticity of the human body and
Oh.
form, not necessarily the plastic that we think of in our world today, plastic, but then even that has evolved, sort of the definition of what does plastic surgery
It's
mean.
so funny. It's like neuroplasticity,
Yeah.
plastic surgery,
Exactly.
plasticity
Yep,
of
it's
the body.
change. It's the change. And so I guess what drew me to plastic surgery was being a part of that change. And sometimes it's not always, a positive change in the beginning. Sometimes you are dealing with people who are going through cancer or having, a hard time or had an accident or a trauma. But sometimes you get to deal with people who are choosing to have surgery or to make some sort of change. So it's fun to be a part of that in whatever way that means for them.
So what I hear you say is your practice is really diverse. You do a lot of different things.
Lots of different things.
Well, let's
Yeah.
talk about some fun stuff. What are some of the things that are trending 2024, 2025 that surprise you or are exciting?
Well, I think one big trend that I love is the idea of going for a more natural look. And that will ebb and flow. Probably next year that'll be out again. But
Right.
I have found that patients are looking for maybe more conservative changes and things that really truly do more so enhance their appearance or take them back to maybe how they looked 10 years ago, as
Okay.
opposed to trying to look like a celebrity or trying to look like someone they never really were. So that has been a huge change.
So if David and I come in for different things and we're both like, okay, I mean, I'm 20 years older than he is. I would love to know what I could do to look the best I can look. And as a guy, I want to know what I could do to look the best I want to do. How does all that work with your plastic surgery? Do I
Yeah.
come in and just say, help me here? Right.
Yeah,
Some
or
people
what do you
do.
Which
think?
area? Pick an area.
On a canvas, blank canvas.
Exactly. Here are all the things that kind of
There are lots of ways it could go. I'd say for me, when I have a consultation with someone, the most important thing to me is finding out what really bothers that person, what brought you in the first place.
What's
What was it
bugging
that you
you?
woke up and said, I'm going to do something about this? And it's not so much about me making suggestions because quite frankly, none of us are, the book perfect and
Right,
we all
exactly.
have
We
things
don't-
that bother
right.
us,
She's looking at me when she says that.
I got nothing
except you.
except you.
But yeah, I usually start with what is it that really irks you that if you felt like this changed, it would change my day-to-day life. And those are the areas where you really do make a really nice positive change without going too far. So I never make suggestions when people didn't mention it in the first place. So it's a delicate balance there.
Do you have to be concerned if people have realistic expectations? I mean, I would love to have
Yes.
a facelift and I would like to look like I'm 18 years old and Bo Derek. You know what I'm
she is
saying?
beautiful.
Where we come in and we say,
Right.
here's what I really want to look like or what I want done, and here's
I
my
think that is
expectation.
very, very important, critical, the realistic expectation. And quite honestly, I've had my own plastic surgery. I had babies and C-section scars that looked like someone was drunk. It
Okay.
wasn't her fault. It was just my body. But, there's certain things that you just say, I just don't want to live with this anymore. And I had the same conversation with my surgeon. Okay, what can I expect? What can you do? What do you think you can't do? But I think patients are happier in the end when they know what those limitations are. And sometimes that means sitting down and looking at photographs of other people.
Okay.
Sometimes that means sitting down and looking at photographs of themselves, because looking at a photograph of you is not the same as looking at yourself in a mirror.
Okay, that's fair.
And when things are blown up and we're kind of drawing, and I think that is a really important thing, especially when it comes to the recovery process. I think people in their minds sometimes think, I pop in and pop out, and like that was easy.
Yeah, exactly.
And some things are fairly easy, but some things really require time off work, time off the gym, time off of lifting your children, and those things. I think if you aren't prepared, it just leaves sort of a unflavorful taste in people's mouths. You really want to know, what am I getting into, and what can I really expect to look like, and my recovery to be.
Can you do a master plan? In other words, can I come in and say,
Sure.
okay, here's what I'm thinking. Here are the 3 areas I really want to tackle. And you can say, here's what I would do. Or
Yeah,
And
oh,
then
absolutely.
for guys, what are guys doing these days?
So to answer your first question, I do think plans are great. And
Okay, so
sometimes
plans
it
are great.
is, my daughter's getting married next year. Here's how much time I have. Sometimes it's my daughter's getting married in 3 weeks. That's a different plan. Okay, so knowing what someone's goals are, or like I saw a lady this morning and she has certain concerns, but she's in a weight loss journey. And I said,
Okay.
really the best thing to do for you and I is to wait until you've reached your goals, and we can talk about it now, but let's make a plan. Let's make a goal for your weight loss and a goal for your surgery. Men are extremely interested now,
And you said they're coming in. I mean,
they feel safe now.
Good.
Sometimes they sneak in with their spouse, kind of tippy toe in the back, and while we're here, sometimes they come in on their own. But yes, between Botox and lots of the other,
Botox, I love that.
I'm telling you, it's a thing. But I think men do feel like, why can't I? I mean, who said that I can't? And sometimes it doesn't have to be extreme things. Neck lifts are very common in men. Men get bothered by sort of things here, but they don't want visible scars. And so there's definitely some wiggle room there, but they feel much more comfortable now than they did before.
Okay, then I'm going to ask the real question we're all asking. So have facelifts changed to where there are a variety of ways that you can perhaps, just throwing it out there, when I stand in a mirror and I sort of do this and I'm like, oh, I love
There's
this
actually
girl.
a name for that move.
Oh, what is?
This is called the facelift move. That
Is that
means
a
you're ready.
facelift move?
That means you're ready. Yeah.
That means you're.
I
I mean,
know.
not you.
Did you hear what she said though? That means you're ready.
That
If
means-
you do the move, it
the
means you're ready.
hypothetical.
Just saying.
there are so many technologies out there, and injectables and non-surgical things, and some of them really are very powerful, and I think really are legitimate. The problem is all the other stuff, and I think that's where it really comes down to having a trusting relationship with your surgeon, even if they're not operating on you. Tell me, here are my goals, and I'm not ready for surgery yet. What can
Okay.
I do in the meantime? Or I read about this on,
Right.
saw it on YouTube. Does it work? Because there's so much out there that is just.
So let's
No, we
just
talked about that.
Let's just say, yeah, we
Not
just
everything
talked
on the
about
internet's
that.
true.
Yeah, don't go down
Right.
the Google tube, right? Exactly. I mean,
And I think too, especially with social media, but all of those photos are, they're filtered and they're photoshopped. And so when especially younger people come in and that is their expectation, it's like,
No.
not only can I not do, nobody can do that for you. That is a filter, and maybe here's something we should talk about instead. So there are lots of options out there, but I think having that honest relationship, that honest communication, goes a long way.
so not that I'm pushing you out of the way, but let's just say hypothetically someone's in their early 70s, hypothetically, and a woman.
Asking for a friend.
Asking
for a
yes, I
friend.
love that. We should do that as a segment. Asking for a friend
I love that.
who does this move sometimes. Would you hypothetically throw out 2 or 3 different
Sure.
options?
Yep. And sometimes people are very clear. I've had patients say, Great Aunt Susie had a terrible experience with anesthesia, and even if it's irrational, I'm terrified of it. What can I do that's over here? Usually on the way out the door, they'll say, well, what if we did do something surgical?
Right.
Show me an option. Show me what that looks like financially. Show me what that looks like downtime-wise, expectation for a result. And people will often lead themselves down a certain, and you can tell if you spend enough time talking to somebody, okay, where does this person's comfort level lead them, and what are they looking to achieve? But that
Can you
helps me.
have something like that done? Could David and I potentially hypothetically have something like that done where you wouldn't be able to tell? I mean,
I'd
you
say
would just look, oh, she
refreshed.
looks so much
Refreshed.
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 I love that.
Yep.
I'm feeling very refreshed.
That's our takeaway for this whole
like it.
Yes.
I feel like me. Honestly, and every surgeon, of course, is different. And you'll go to especially these bigger cities, Miami, LA, Chicago, and people are often looking for extreme things, or they're in a business where that is sort of the expectation.
Yes.
I'd say for me, for my practice for this area, people often come in and they say, I don't want anyone to come up to me at the grocery store and say, what did you do?
What did you do? Yeah.
So I've got a couple tricks. One is to
Tricks, I love
go
a good trick,
for a
right.
natural look. You don't want people to look over tightened. You don't want people to look like, this looks great and all of
And-
this looks terrible and these look terrible. You want to kind of match yourself, your
Yeah.
peers. I tell people, 2 days before surgery, you're not going to see anybody. Go get a different hairstyle, a different color, a slightly different bang, a da-da-da. They emerge, a week and a half later and people say, did
Oh
you
my
get a
God, the
haircut?
haircut. You look so good.
Yeah, I think you got a haircut. And then they can mentally check off their box, oh, she got a haircut, that's what it was. But you know what it was. And so I think that style or that trend for me is
the way to
perfect.
go.
Yeah, I like that sort of, I look great, I look like me 10 to 15 years ago. But when people start bringing in pictures of the celebrities and things, which
Yeah.
again is not so much anymore, it's like they never looked like that in the first place. So that's a little bit more of a challenge. And sometimes, quite honestly, I'm not the right surgeon for
Right.
them.
Exactly. Well, and not to be awkward about it or anything, but are there other, not specifically for guys or girls, but are there other body parts that get plastic surgery? I hear people getting.
Oh, head to toe. Okay, well, head to ankle.
Okay.
I'm not really. I'm not really. Not really.
Well, seriously, I wanted to be 4 inches taller. So I was waiting for that to come.
Head to toe-ish.
Yeah, I'd say body, especially with the weight loss trends and the weight loss
Okay.
medications that are now on the market that are ubiquitous. I mean, everybody has access to them. A lot of people are losing a lot of weight very quickly, which is great. But it does change not only your face, but of course your body. We live in a very warm climate. People want to be in short sleeves and they want
Yes.
to golf. And so, yeah, absolutely. Head to toe, there are definitely things that people will prioritize depending on what bothers them and kind of their lifestyle.
If we could switch gears a little minute about prevention,
Mm-hmm.
let me rephrase that. How should people be treating their skin and their bodies in their teenage, early 20s to help mitigate
Right.
some of
If
that?
we only knew, right?
Right.
Yeah.
So I
Right.
worked at a tanning bed in high school.
And
And then I was a lifeguard.
Probably not a good
Yeah, no. I mean,
those are the best.
the
Sorry,
good
I
old
know they're
days.
bad,
The good
though.
old days.
Yeah.
But had I known then, I'd say absolutely, start as young as you can. Everybody can start sunscreen, when you're 5 years old, start your
Yep.
sunscreen. Everybody can start Botox early. It doesn't have to be large amounts. It doesn't have to be super frequently. But when you start noticing, oh, I'm making that line, or oh, I feel like I'm getting headaches, you can start Botox early. It doesn't mean that you have to do a ton. Things like Retin-A, I mean, my gosh, that's an absolute miracle
Is
medicine.
it?
Oh yeah, everybody should be on some form of topical vitamin A unless you're pregnant or nursing. Disclaimer.
Okay.
But yeah, there are lots of things I think people can start early that don't have to, be a 20-minute process every morning because people are looking for, quick. I don't have all this time to spend on topical creams and lotions and potions, but there are certain ingredients that are absolutely tried and true and can help even in the younger years, for sure.
2 minutes on Botox for migraines. My daughter's a migraine person. Do most patients benefit from Botox that are migraine people?
I'd say almost all. I've never had a patient say that made my migraines worse. I always hear, hey, I noticed that I didn't get headaches last month. I'd say another really
Interesting.
common area is the masseter muscle, so where people tend to clench. We're in a society where everyone's stressed out. I mean, there's not a lot of relaxing throughout it's a stressful life, it's a stressful day. A lot of people are clenching, and you can get headaches from that too. So relaxing the masseter muscle, relaxing the upper face, most people get relief from headaches. Some people in the back of the head as well. Yeah, that's
And how do you know?
common.
So, I'm sorry.
No, that's
How do you know? So my daughter comes to you. I've had 5 migraines a week for the last whatever. Where do you start?
So the most common areas for migraines are the upper face, usually forehead, glabella, sometimes around the eyes. Some people walk in the door. I have a patient I saw yesterday. She took her finger and said, my headache starts right here, every single time.
pinpoint.
And she can pinpoint. Most people, it's the frontal face. Some people walk in and they say, my oral surgeon said I need Botox in my, I'm ruining my teeth and my
Yeah.
gums. So sometimes they'll give you clues, but if not, we start with sort of the upper face, and you'll know within a week that things are better.
It's fun to have her captive. I mean, we get to ask all the questions that we want, because I have one more quick one before we have
Sure.
to go. And that is from a plastic surgery point of view. And as I've gotten older, little dermatological boo-boos that you have to have excised. At what point does it make sense to go to a plastic surgeon to have that kind of surgery?
Yes, that can be tricky. So there's a lot of overlap with plastic surgeons and
Dermatology.
ear, nose, and throat, orthopedics. So a lot of times people are like, so what do you do?
What do you do?
We do lots of things, and some of it does depend on your surgeon. So in our practice, in particular, I work with a board-certified dermatologist. So she and I we
Play off of each other. I
it's
love
like,
that.
you know,
Yeah.
I feel like I can go this far with it, then I need you to do this, or I'll say I saw this spot and this person has a rash. If you can't cut it, I'm not your girl. So,
Okay.
so
Tissue is the issue for you.
when in doubt, cut it out. So, so we kind of go back and forth a little bit. But yes, oftentimes plastic surgeons are involved in complex closures, sensitive areas, things on
Okay.
your face, on your mouth, on your
Got it.
nose, where, yes, of course you want the cancer gone, but you have to keep in mind, okay, after that,
Right.
you know, I'm
How
still
am
a
I gonna
person.
look?
Yeah, I want to
Right.
look as good as I can. So yeah, between that, and there are things like lasers and microneedling and certain silicone scars. I mean, there's lots of things in our toolbox that if people are really concerned about how things are going to look, which I think it's perfectly fine to be concerned about that and important, that they've got at their disposal.
When is it appropriate if I'm at the dermatologist's office and they say, well, I want to remove this? I'm thinking, you know, maybe I want a plastic surgeon to do it and not.
Absolutely.
Because I've seen some other scars that they're not done well.
Right.
Is it
Yeah.
appropriate to say that? Like,
Absolutely.
you know, I'd rather appreciate it, but I would want to get.
Sure, or you can always, get information gather. There's nothing wrong with information gathering, and then, call your plastic surgeon's office and say, hey, I'd like to just come in and talk about my options. But I think, having an informed patient, no matter which way they go, and that shouldn't be offensive
Yeah, no, I
to a
agree with
physician,
that.
because I'm not going to operate on every single person on this island, and that's not offensive to me. But I think getting information and arming yourself with before you make a decision is important.
Dr. Audrey Klenke, as always, it is great to see
Thank
you, and you
you.
have really contributed here to
Yes.
our show.
I appreciate you having me.
Mind your health.
Mind your health, mind your health, mind your health, mind your health.